Hey guys, it's Kelly. I thought I would make a video showing you things that you will need for plastic surgery because going into this, I didn't really realize I would have to buy so many things. So luckily I had room available on my credit card to buy this stuff once I got out here. And just to recap, I had a lower body lift, which is kind of like a tummy tuck, fat transfer to butt, and an arm lift. So of course, what you need will be dependent on your surgery. However, I think a lot of these things, probably a lot of different surgeries would need these. So let me bring you over to the spread I created. I'm going to start out over here. I had a lot of people tell me that they highly recommended having a recliner for recovery. To be perfectly honest, I never sat in it because it was uncomfortable for me, but I've heard a lot of people say that they slept in a recliner for the first week or two after surgery. Something that was helpful the first couple days was a footstool to get in and out of bed. It wasn't absolutely necessary, but it did help a couple times. Something that's still helpful to me to this day is slip-on shoes because it's hard to bend over. Now I'm going to move over to the bed where I've set everything up, and this is kind of in no particular order. And again, the things may vary depending on what surgery you had, but I think a lot of these things could be useful to anybody having plastic surgery. The first thing was just having a general first aid kit. A lot of times we would realize we needed something, but we didn't have it. So being able to reach in here to have like maybe a miniature version of it was really helpful until we could get to the store and buy what we actually needed. When you first get out of surgery, you could be oozing, bleeding, leaking. So having some sort of pad to lay on is helpful. These are actually doggy pee pads because they're cheaper than buying the human ones, and they work just as well. Something we found that actually worked better was this pad from CVS. I believe it was $12, and it's washable. So I just laid on that the first couple days. Luckily, I wasn't bleeding too much. Surgical dressings. Every day I have to change my dressings. I know some doctors recommend doing it twice. I actually only do it once. These things were insanely expensive. For a box of 12, they range between $10 and $15. So what we ended up using later, and my doctor actually recommended it, was maxi pads, which sounds kind of gross. But if you look here, I have one that's semi-open. It's pretty much the same thing. You know, it's a sterile material. Just make sure you get ones that are non-scented. I had the bigger ones for my stomach area, and I have these for my arm lift, the smaller ones. I did make the mistake, and I had a box that was scented, so I had to get rid of those and use just the unscented ones. Speaking of scented and unscented, after sleeping in the same bed for however many hours straight and just getting up here and there to walk, the room got kind of stinky, and I didn't like that, so I had my fiance go get me some Febreze, so it's nice just to freshen up the room that you're sleeping in. Baby wipes, again, unscented. Those were helpful the first few days. Moving on. These pads have come in really helpful. I have to keep my incision line dry, so occasionally I might wipe my arm with this just to make sure I haven't sweat on it. These have come in helpful to wipe things with alcohol. I've used these for a lot of different reasons, but they're the cotton swabs. They're the flat ones. And of course, for sterilizing things or cleaning wounds, depending on the wound, hydrogen peroxide or alcohol. Sterile gauze pads have come in very handy. One thing that I've used a ton of is medical adhesive tape. Originally, we bought a couple small ones. Then later, I realized I should just be smart and buy the bigger one. It's only $1 more for twice as much. But I've used a ton of that. I'm going to move over here. Plastic gloves and Q-tips have been really helpful when it comes to putting on things like Neosporin. I bought this store brand one. It's the same exact ingredients, but it costs less. Speaking of medicines and store brand stuff, when I first had surgery, I was told to take a pain reliever. I was given a narcotic one, but it was making me nauseous, so I stopped. So then I was told to take a non-aspirin pain reliever. So I started out with this acetaminophen, which is like Tylenol. But now that I'm actually preparing to go home, my doctor has switched me to aspirin because he says he wants my blood to start being thinned out before the airline ride. The other thing, like this is my Augmentin, which is my prescription. I did mention this in a previous video. If you don't have insurance, make sure you shop around for your prescriptions because at Rite Aid, they wanted $250, but CVS only wanted $99, and that's a really big difference for someone that doesn't have insurance. Moving on, here's some, I didn't end up using this, but somebody told me that they got really itchy afterwards, so I had an anti-itch cream. Another thing that would work for itching is Benadryl. I did use this a couple times. I was a little bit itchy at first, but not bad enough to actually use a cream. Now this one is something that I in my life have never had a problem with, and I thought for sure I wouldn't have a problem with it afterwards. It's called a traumatic bowel movement after plastic surgery, or I guess any kind of surgery. I hear that the anesthesia messes with you being able to go to the bathroom. So somebody had given me this. It's some sort of bowel movement stimulator. I don't even know the word for it. And also they gave me some X-Lax. At first I really didn't think I was going to need it, but about a week in I realized that I did need it. So I highly recommend having something to help you out with that sort of thing. When it comes to Ace bandages, I know the old kind used to have like those little metal clips, but now they sell them with Velcro so they can stick to itself. Or this one is actually a sticky one where it sticks to itself, which is really helpful. The whole thing is sticky. Things later I realized when you bathe, it's good to have a little bucket to put the soap and the water in. Originally I was using this for my wound healing because it was something that the nurse brought, and the doctor actually had the same brand of soap in his office. But then later I saw a store brand that was cheaper, same ingredients, and what's really funny is this one was red, so I almost felt like I was doing something good, like, oh, it's red, it must really be hibiscus because it's called Hibby Cleanse. But then I read the ingredients and saw that it had red number 40, and that kind of freaked me out. So when I thought I was actually cleaning myself because the soap was red, turns out it was just a dye. But this one does not have that in there. A thermometer was helpful. At first my temperature was going up. I may have hit 100 at one point, but it never went any higher than that. The mirror has been invaluable to me. When you can't see your incision line, or when you're worried about something feels funny, you can take the mirror and check it out and see how it looks. This pan was really helpful when it came to emptying my drains. I wanted to showcase a towel. I never reuse washcloths or towels since I've been through this process. Every single time I use a fresh one. I just prefer not to spread any germs or bacteria or anything that could have grown. Tons of pillows. There's 9 here. To be honest, I was using more at one point, and this almost is not enough, but I made it work. The mini pillow has been helpful, sometimes with my arms. Okay, back over here. This little back scratcher thing, as funny as it is, it's been very helpful. For my arms, it's actually been kind of hard to brush my teeth, so it's nice to have mouthwash. And then when I wanted to floss, of course, using these little things is much better than using an actual roll of floss. Tweezers. I definitely recommend having tweezers, especially if you're into plucking your eyebrows. I couldn't find my tweezers for the first week, and I was getting really stressed out because of my eyebrows. Now that my internal sutures are starting to push themselves out, I have to have a pair of scissors and a pair of tweezers. These are actually not the pair I'm going to use. I need a better pair because when they stick out, I have to kind of pull it a little and cut. So I'm going to need another pair of tweezers, probably like the needle nose plier type deal. Lotion, if you can talk people into giving you a massage. And lastly, these two are for scar treatment. This is something my doctor just gave me 2 days ago or yesterday. Once you get far enough out, they tell you to start putting things on your incision line for scars. Over here is my wardrobe. It's very small, as you can see. I only brought things that weren't going to touch my arms, and these little robe things have been extremely helpful. They just tie around the waist, but I have 2 different ones here. They're kind of ugly, but who cares? No one sees me walking around. The other thing my fiance did for me before he left, because he had to go back before me, was I can't bend over, so having things up and in your reach is a really big deal. So he set this up for me so I wouldn't have to bend down and grab my bag later, or the computer bag. So yeah, there's all the stuff that I've used. You can see how it adds up quickly. Hopefully this was helpful to you guys. Talk to you later. Bye-bye.